Hi, my name is Marisa Salisbury, and I'm going to talk to you today about leptospirosis in Puerto Rico. So all of you sitting in this room have the potential to reduce or eliminate transmission within your communities, within your professions, within the entire island of Puerto Rico. So we have people that are in professions like human health, veterinary health. We have some municipality representatives here, people that work at farms, other community members. We have people here that, again, can eliminate or reduce the transmission of this particular bacteria on the island of Puerto Rico. So this infographic is going to be pretty important, and we're going to be pulling this apart as we're going through. We're going to talk about prevalence and incidence. We're going to talk about the causes and how we can reduce it within our communities. So this data is really important, and this is really the basis for everything I'm going to talk to you about. So when I looked at data for a 5-year period of time, so this is from 2014 to 2018, the number of confirmed, and you'll find out why it's important I'm saying confirmed cases of leptospirosis in Puerto Rico was 386. In the United States, during that same period of time, the same 5 years, was 319. So the island of Puerto Rico, that has a population of roughly 3.2 million, had more confirmed cases of leptospirosis than the entire United States. This means continental, Alaska, and Hawaii. Now, the U.S. population has 100 times that of Puerto Rico. It has about 330 million. Yet, Puerto Rico had more confirmed cases. Why is that? Let's talk about that for a minute. So many of you may have never heard of leptospirosis sitting here. So leptospirosis is actually an infection from Leptospira, which is a spirochete bacteria. Now, spirochete only describes the shape. Okay, it means corkscrew. So if you look at the picture on your left, that is actually a picture of Leptospira. It's the most common worldwide zoonotic disease. And zoonotic means that it's something that animals have and can transmit to people. It has multiple pathogenic species and serovars. Now that may be like, what the heck? But this is the one thing you want me to pull from this if you've never heard this before. Pathogenic is disease causing, and all it means is that there are many types of it. So the significant part to pull from this is that there are many types because there are many different animals that can have different types. So for instance, one of the pathogenic species or types of Leptospira is icterhemorrhagia, and that is transmitted from rodents. So that's all I want you to pull from that, and we'll talk about the other animals here shortly. So it's transmitted through urine, contaminated water, soil, and mud. So anything that urine that has that bacteria that can touch has the potential to transmit the bacteria. And what are the symptoms? Well, what are the symptoms? And we're also going to talk about clinical signs. So remember, this is in animals. Clinical signs, animals can't complain to you. They can't tell you what doesn't feel well. So we talk about what we see or signs. Symptoms in people are headache, chills, nausea, vomiting, diarrhea, and cough. Those are very similar to the symptoms you would see with dengue. And this is why I was stressing with you about confirmed cases. The belief is that there are actually a lot more cases than what we have in that data set that I showed you. And I'll give you an example of a case study of a misdiagnosis. Clinical signs in animals are stillbirths, abortions, fever, jaundice. Jaundice just means yellowing of like the skin and eyes, and hematuria, which is blood in the urine. So people and animals can shed the bacteria without showing any symptoms, so they can appear normal, act normal, not feel sick, and shed the bacteria. More than 90% of infected persons develop mild symptoms, and many of those people actually don't even require medical intervention. Some it may just be antibiotic, and some others may be that they're admitted and they're provided IV fluid, supportive care. On the other hand, 10 to 15% of people actually do die from leptospirosis, from Leptospira. Those that are in agriculture, refuse workers, veterinary professions, and processing or slaughterhouses, those of you you're in this room, you're more likely to develop it on the job. You're exposed to this, and we'll talk about why in a minute, more likely to transmit leptospirosis. There is no vaccine for people. However, there is a vaccine for cows, pigs, dogs, sheep, and horses. Very important, veterinary professionals. Those of you sitting in this room, are you recommending it to your to those that when you visit farms, to pet owners? Because you can help reduce the likelihood of those farm owners or pet owners getting this illness by making sure they're vaccinated, by recommending vaccines. Why is that important? On the island of Puerto Rico, the most common way to get it is actually from animals. Now, this was rather significant to me because usually the most common way is from flooding. In other areas of the United States, when there is a hurricane or flood, that's how usually we see transmission, but not on the island of Puerto Rico. And specifically, the particular animals we're concerned with are cows, horses, rodents, and dogs. Those are the ones we find are the biggest concerns in Puerto Rico. So what we can do, again, is make sure those animals are vaccinated. With flooding, it's making sure that we're not wading in water, as best as we possibly can. Now, this can also influence another way that we can become infected with leptospirosis, and that's through contaminated drinking water. However, I have those separate for a reason, because it doesn't take a flood to have contaminated drinking water. Those of you that are sitting in this room that work at municipalities, are you making sure that your water treatment facilities are maintained? Because if they're not maintained, then you increase the likelihood of having contaminated drinking water and thereby having something like leptospirosis infect the people within your communities. Infrastructure is very important. And there are some of you sitting here that have the power to make sure you're writing budgets for your communities. So are you making sure that there's proper trash pickup? Those of you that are pest control technicians that are sitting here, what are you recommending for people to get rid of their pests? Because the more mice, rodents we have, we increase the likelihood of people acquiring this bacteria. So let's talk about some case studies. Why am I saying to apply these things? Why are we focusing on this transmission route? In 1998, Lake Springfield, which is in Springfield, Illinois, was a place where there was about 900 triathlon swimmers. Okay, so Lake Springfield had about 900 people swimming in it in 1998. Of those approximate 900 people, 98 of them became ill with leptospirosis. Addition to that was another 52 of them that were not showing symptoms, but tested seropositive for leptospirosis. And these were just people that were swimming in the lake. The lake, it turned out, was contaminated with leptospira, and these people actually became ill, or at least showed that they had been in contact with this bacteria. In 2016 in Kenya, there was a study done on 737 workers at about 140 facilities, and when they looked at their blood to see, okay, well, how many of you in your serum, how many of you have come in contact with leptospira? More than 13% of them had come in contact with it. And it was found that the exposure was due to the processing. That was the exposure to that particular bacteria. In Detroit in 2011, there was 70 dogs that were confirmed cases of leptospirosis. Now, why in Detroit? Well, at that time, huge budget issues were happening. Trash was not getting picked up. And as a result, it increased the rodent population within Detroit, and it affected dogs. And it was hitting dogs so hard that there were a handful of cases where the dog went in, the owner took the dog in for a vaccine, the dog had been acting fine, and while they were waiting to be seen, the dog dropped dead. And there were actually a handful of cases of this. So it's very important, again, municipal workers out here, legislators, are you making sure that the budget is there for trash pickup? Because if not, you're creating a potential for disease transmission for diseases like leptospirosis. A study was done on a farm in Puerto Rico, and they caught house mice, black rats, and Norway rats, trying to see how many of them actually have been in contact with leptospirosis. How many of them are positive? More than 54% of house mice were positive for leptospirosis. 34% of black rats and 20% of Norway rats had it. So what does that mean? Those of you that are sitting in this room that work at a farm or that own a farm, how many of you have actually seen rodents around like feed areas, right? Or making nests in hay? Well, if we're not keeping down our rodent population on our farms, we're increasing the likelihood of us being transmitted. We're increasing likelihood of transmitting to our cows. Because think about that. If they're nesting in hay, they're urinating in hay, and then our cows are eating it, right? So we're creating this cycle of potential transmission to us on our farms. And this is the case I kind of alluded to at the beginning when I was talking about with the confusion and misdiagnosed with dengue. So those of you that are not familiar with the abbreviations, sit tight. I'm going to go over them with you right now. So there was a 25-year-old male who presented to a hospital with 4-day history of chills, headache, malaise, and myalgia. So basically, he wasn't feeling well, and he ached everywhere, okay? The diagnosis was dengue. So he spent 4 days in the hospital, And on the 5th day, he was released. Now, when he was released was when he was tested for leptospirosis. It came back positive. He did not have dengue. So he had 8 days that we know of illness before he was tested. Well, here's the concern with that. During that time, if patients misdiagnose, we have a potential of transmission that person becomes infectious as somebody else, especially like if he wasn't at home, if he was being treated, or wasn't home, being treated at home. We reduce the likelihood of tracing back to find out, well, what actually made him sick, because the people's memory only lasts so long. So the longer we wait before we talk to them about transmission, the less likely we have to find out what it is, because dengue is transmitted from mosquitoes. It is not even transmitted the same way. So we lessen the likelihood of determining what was the route this person picked it up. Okay? So this is rather important that we're making sure we're diagnosing, and we have laboratory facilities that are able to diagnose leptospirosis, and so that we can properly find out what the transmission source is. This beautiful little chart here is the reason why all of you are sitting in this room today. So like I said, we have people in here from legislators. We have people in here that are global partners. We have someone in here from the United States Department of Agriculture. We have people that work here in animal processing, at pest control, and veterinary facilities. We have some community members that just wanted to find out what information we're talking about. We have some public health department people. All of you sitting here can reduce the likelihood of transmission within your communities and reduce your likelihood of transmitting the disease as well, either in your homes, in your professions, and in your workplaces. Okay? So let's talk about that for a minute. Those of you that work in, let's say, the slaughterhouses or veterinary facilities, are you wearing proper PPE? Are you wearing proper personal protective equipment like gloves? Veterinarians, are you recommending to your clients about vaccines for their pets, their cattle, their sheep, their horses, and so on? Are you doing that? Because both of you are reducing your own transmission, or you're reducing transmission within your communities. Now, how about legislators and global partners? Legislators, are you making sure there's a budget that's going to reduce pests within communities? Global partners, are you making sure that we're reporting as we should when there's an outbreak in Puerto Rico? And are we watching for outbreaks in other countries to make sure we're not importing something that could be infected? So that we're not bringing in those other pathogenic strains of Leptospira into Puerto Rico, right? These are really important parts of making sure we're keeping us safe, that there's money to keep us safe, that there's proper resources and expertise to keep us safe, as well as proper reporting techniques. What about those that work in prevention and treatment? Doctors, are you making sure that you're asking people, do you have pets? Are you making sure that you're asking them if they work on a farm? Because if they do, then not only do you need to be aware of, because if they develop the signs of fever, chills, malaise, myalgia, if they develop those signs, are you making sure that you're ruling out dengue and to see if it's lepto? Additionally, are you recommending them to make sure to take their pet in, or that their farm animals are vaccinated? Are you recommending them to see a veterinarian? What about treatment? Are you making sure that you're getting a proper history? Because like the comment I made about the 25-year-old that was misdiagnosed, if we're not getting a proper history and it turns out that it is a leptospirosis case, we may lose the ability to find out and trace back to what was the cause, so we can prevent other people from getting this bacteria. And those in the veterinary profession, you have an important role in Sentinel. If you have a dog that comes back as positive, it is a reportable disease. It is a federal reportable disease. So are you making sure to report that? Because if we have, especially when you start seeing a trend or more animals that have it, then the concern is, well, what humans are in the area that could be also transmitting that bacteria? What other animals, what animals are susceptible and could be transmitting that bacteria to the people that handle them and work around them? So going back to this, let's look back at this infographic again. So here we have a large rate difference in Puerto Rico, 319 cases in a 320 million population in the United States versus 386 in the Puerto Rican island with a population of 3.2 million. And we discovered today that flooding is not the primary cause. It's actually zoonosis is the primary cause. And the data showed that diagnosed cases, confirmed cases, were higher regardless of the weather. And we talked about how our professions can contribute or eliminate and mitigate disease transmission in our communities. Thank you so much for your time, and I hope you have a wonderful day.